My name's Dr. Michelle Sancho and I'm an educational psychologist. I've got a special interest in early intervention with regards to mental health in children and young people. So in terms of how much a problem depression is, I would say that a lot more children and young people have low mood than one would probably think. Research tells us that it's probably at least 2 or 3 in the average classroom of 30. But I think the difficulty might be for teachers in particular, or school staff, is that depression as we would imagine it would present isn't always how it presents. So with adolescents, a lot of the time they might have signs of irritability. So they might be getting into trouble, getting detentions or getting thrown out of class. And actually that's masking low mood as actually the main difficulty that they might have. Certainly before I started having a special interest in mental health and depression, I wouldn't have known that that was a core symptom for depression. So that could be misinterpreted really as somebody who's just been naughty or not following instructions. But I guess the key thing is that they'd be wanting to look for change. The other reason why it might be missed is because adolescence is a time when there's lots of changes and lots of young people change and develop and are quite different. But the core things that we'd be really wanting teachers to look out for are, sort of the young person's actually not coming to school because they can't get out of bed in the morning. So it could be that level of difficulty that they might be having. Or it could be that they're coming to school but they're just withdrawn. So it's having a big impact on their friendships. But it also could have an impact on their attainment, so they might be not performing as well as they were previously or just having difficulty concentrating. I think teachers often lack confidence in this area because they hear the term mental health or depression and they worry that they don't have the expertise to deal with young people, but actually they're often the best placed people to have the initial conversations with young people because young people will know them well, they'll have the relationship with them. I guess it's just about opening up and having that conversation, that starting conversation, just to find out what's going on for that young person to try and understand. And it's not really about giving that young person advice at this point, it's just about hearing what's going on for that young person and trying to understand more. Much easier, I would imagine, for the young person to open up to somebody they know and are familiar with than a strange professional, who, like the GP who they may or may not know. And outside the context where they spend most of their time. So in terms of advice that I would give a teacher who is concerned about having that first conversation because they feel that they might make things worse, just take a curious stance in terms of finding out what's going on for that young person.